Hello class, my name is Jordan Shepherd and I'm in Ms. Watt's Bio 166 W1 2018 Fall Semester class. The topic that I have chosen to discuss for my teaching assignment is coronary artery disease. So what is coronary artery disease? This is a disease of the coronary arteries whenever they have been damaged or have been affected by a disease. They can be damaged by a buildup of plaque, which will narrow the coronary arteries, reducing the amount of blood flow to the myocardium. So who is affected by coronary artery disease? Approximately 7 million people are affected by this disease annually. Men are more likely to be diagnosed with coronary artery disease than women are, and there is no explanation why men have just been proven to be diagnosed at higher rates than women. However, whenever women have experienced menopause, that's whenever their risk for being diagnosed with coronary artery disease increases. Also, whenever women reach the age of 70, their increase for coronary artery disease increases as well. Whites, African Americans, and Hispanics are the three races that are likely to be diagnosed with coronary artery disease in the United States. So, risk factors and causes. There's a wide variety of causes that can lead to coronary artery disease. This includes smoking, diabetes, high levels of cholesterol, high blood pressure, sedentary lifestyle, obesity, high levels of stress, and a family history of coronary artery disease. Several of these risk factors can actually be prevented. That way, the chances of you being diagnosed with coronary artery disease decreases. An individual can drop some of their bad habits like smoking, reducing the amount of stress levels they have, working towards living a healthier lifestyle with healthier foods, healthier energy and positivity around them, and more physical activity to help reduce weight loss and reduce obesity, and just to get them out of a sedentary lifestyle. A more active and healthy lifestyle will help decrease the risk of the individual being affected by coronary artery disease. Foods with high cholesterol and high sodium, the individual should try to reduce the amount of foods they eat like that and work towards eating healthier. Some causes just can't be prevented, especially if it runs in the family, and you can try to break the cycle by dropping these bad habits and working towards being healthier. Symptoms also kind of range in a different variety. People can go years without noticing any symptoms that they have coronary artery disease. They can go decades and not notice it, except one day they could have a heart attack out of nowhere with no previous symptoms showing that they had coronary artery disease. Other symptoms that the individual may feel is chest pain, shortness of breath, and the worst case scenario, a heart attack. And all this depends on the severity of the case, depending on the person, and the lifestyle they live will depend on the symptoms they experience firsthand. So treatments, there's also a wide variety of treatment options for the individual to take on. Lifestyle changes is definitely a must. You have to want to make a change yourself in order for your lifestyle to be changed and for you to be a healthier person. You have to start eating healthier, exercising more, and telling yourself that you want this, you want to be healthy. You have to have the mindset to get you through. Prescription drugs, the doctor can prescribe different drugs that will help decrease the amount of plaque in the arteries to increase the amount of blood flow to the myocardium to function for the body. Several medical procedures can be done, like a stent replacement, coronary artery bypass surgery. This really all just depends on the severity of the case and what the individual actually prefers themselves. And some of the prescription drugs, even a common one is aspirin, and then you have beta blockers and calcium channel blockers, so different drugs like that. And those are my references. So thank you very much.